Tempa, how are you?
I'm good. Say, how are you?
I'm good. Are you really good?
I'm tired.
You tired?
Yeah, I am tired. I can feel that I'm going into that sort of overwhelming state, but it's just exam anxiety. But I'll be fine.
And you're in 6th year?
Yeah.
That's the
final
thing.
year.
Final year. Sorry. My name is Kuliso Ramashia. I'm the 5th year MBCHB coordinator at Nelson Mandela University. Sitting beside me is the Honorable, soon to be Dr. Mpelo.
Yes.
Dr. Mpelo from, where are you from, by the way?
So my name is Tebo Mpelo, as Dr. Ramashia has said. I am from a small town in Free State called Botshabelo.
So you obviously did well in matric, I'm assuming.
Yes.
How well did you do? What is your AP score? What is it called? AS score?
My APS.
Yeah.
It was 43. Yeah, it was 43.
And you did matric in
2020. COVID.
Ooh. Yeah. Because now the AS scores go in hundreds, 100, 200, and so your score then, what did you get in physics? Do you remember?
In physics, the percentage was 92. 92%. Yeah.
Mathematics?
Mathematics was 88.
English?
English was 76. But
That's low, low for you. Yeah. And life science, I'm assuming.
Life sciences was the same as mathematics. They were both 88.
They were up there.
Yeah.
So that's a 7, I think. Those are all 7.
Yeah.
Okay. We'll get to AS scores. That's a very good AS score, by the way.
Yeah.
So you said you did matric in 2020.
2020, yeah.
So you started at our med school in 2021.
2021.
You're the first class.
First class.
What were you doing? What were you thinking?
NMU actually saved me.
Okay.
Yeah, NMU actually saved me because 2020, there I am. We are told that there's this horrible illness that came and we gotta be quarantined. And I'm like, is there gonna be like a life after this? There was just a lot going in my mind. We are at our homes. I'm not thinking about varsity, I'm partially thinking about matric. But I kept pushing where I could, and then jiggy, we have to go back to school.
Matric now. But in school, you're still in school.
So we got quarantined around March in matric, just after first term. And then there was a quarantine. I never wrote my June exams in matric.
Okay.
2020 class, they know. We didn't write our June exams. So that's when there wasn't much hope that I was even gonna write my trial and therefore my term 4 exams. And then just after June, we are called back, guys. The school is continuing. Now everything needs to be rushed up. You gotta now finish the content in maths, physics, and it was a lot.
So had you applied for varsity by then?
No.
Nothing.
It was all me trying to finish and pass matric. God knows what could have come up. And then vets opened applications. I applied what I could. I applied for physics, I applied for Bachelor of Science in Biomedicine. And then later, around December, NMU opened applications. Goodness. And it was medicine. NMU's opening medical school, and I'm like, yes, another chance to be a doctor. Still no hope though. Because the first class, it only took 50 people. Out of, I think NMU had about 9,000 applications. I'm like, there is no way I'm gonna make it, but I just applied. I gave it my all. I applied, had all the documentations necessary.
And here you are.
Here I am.
Goodness. Hey, okay. So now it's 2021.
Yes.
You're starting here. You are from
Botshabelo.
So you've never been to the Bay, as I call it?
No, never seen the beach.
Never seen the beach?
Yes.
Okay. And had you ever done any job shadowing? Did you know anything about being a doctor, about medicine?
I saw doctors on TV. I saw doctors on Generations. Generations, the legacy. Yeah, there was Dr. Sipesihle there, you know, Dr. Elizabeth Koskimsa.
Yeah.
Those are the kind of doctors I saw. I never even watched The Good Doctor. I started watching The Good Doctor in my first year when I got here. Before university, I only knew a person in a white lab coat and a stethoscope.
That was it.
What they did, not really knew much about it. Because I'm not, like, I don't get sick.
Yes,
I don't get sick that I need hospitalization. So I've never actually, before varsity, interact with a doctor. But I knew I had to be.
You wanted to be a doctor. So that means you learned how to be a doctor here.
I learned how to be a doctor and what a doctor is here.
That was in first year?
That was from first year until now.
Take me through first and second year. What are the courses? From what you remember?
So in first year, we got here and there's this thing called basic medical sciences. So there we get introduced to medicine-related physical sciences and chemistry. You know, we don't go deep into the mechanics and whatnot. It's the one that's related to medicine, but it's physics. Chemistry, the one that's related to medicine. We do that for term 1, just until, you know, term 1 ends, and then the same module of basic medical sciences, it's a big module. Then it continues to be biochemistry. Now we do life at molecular level. What happens to the sweet when you eat it? The glycolysis, the Krebs cycles. Oh my goodness.
Those are your things.
That's actually traumatic to even think of. I'm glad I got over that.
You were done,
You know, the same module of basic medical sciences, it progresses into cell biology. Now what are the components of a cell? You know, what is made of, anatomy, basic anatomy. We start in first year. The bones, you know, a little bit about reproductive system, some embryology. So embryology is the formation of a human being. Physiology. Physiology is this part of basic medical sciences where we are introduced to the functions of the body structures. Yes, you know the structure of the heart, that's anatomy. The heart beats, the electricity in the heart, that's physiology. You know, that's what we did. That's one part. That's the scientific part of being a doctor.
But then
NMU understood that you don't just become a scientist as a doctor. You also need to be a human.
Because you live in South Africa.
Other modules that we then did is something called Theory and Practice of Medicine. Shout out to Dr. Kovaci. She did a really good job. Now this is when I understood that a doctor, you are a scholar. You know, you are a professional. How to conduct yourself as a doctor.
What did you do in the course?
We were taught ethics. Like the ethics that guide health, not just doctors. You know, respect for autonomy. You need to know that patients' decisions need to be understood.
Did you go to the hospital?
In first year, we did a bit of clinics.
When did you start feeling medicine?
Second year.
Second year?
Second year, we did, now it was like advanced anatomy and physiology with practicals. And then we were introduced to the cadavers. I can never forget
What's
that.
a cadaver?
A cadaver is a donated human body that has demised.
Demised meaning?
Demised meaning
passed away.
Passed away. It's not group of students, it's not one body for the whole class, it's multiple bodies, and then we group ourselves.
So what do you do with the body?
We open it up.
Dissect it.
We dissect it. That's the term we use medically to open something up. We dissect it, we learn on it, you know, and these are we honor them. While we're doing this. We respect these bodies, because that's where our education, most of our education, my first time holding a human heart is the one that I went to fetch.
So you physically held
I opened the chest, and I physically took it out.
This was in second year?
This was in second year.
You were in matric like a few months before.
A few months ago, I was in matric. Now we are opening a body up. You know, I remember the first time we were introduced to these cadavers. Yo, man, they were covered in white things, like white cloths. You know, yo, it was quite emotional. Yeah, it was quite emotional. But I want to tell you something that even then I was still not scared.
You weren't?
I was still not scared. There was just something inside that was stronger than all of that. Yeah. And I'm seeing it today. And here it is now.
I want you to tell me about the clinical years.
Yeah.
You said you're in final year.
Final
not
year.
Sixth year.
Yes.
Okay. How has it been? You were the first cohort to do clinical years in PE.
Yes.
And you were based at which hospitals?
So there are 3 hospitals here in PE. We use the 4th one in Utenake Provincial Hospital. But the tertiary hospitals that we use is Doranginza Hospital here in Zwide.
And that's where you do?
That's where we do pediatrics, we do obstetrics and gynecology, we do burns, as well as pediatric surgery. That's what we do. And then there's Livingston Hospital. That's where we do now the other big modules. Internal medicine, we do it there. Emergency medicine and radiology, we introduced to that in 4th year a bit. We do it in Livingston as well. There's general surgery, that's also at Livingston. I just want to see if I'm forgetting something. Yeah, basically, those are the modules we do.
Do you guys do psychiatry?
Livingston. So yes, there's Elizabeth Donkin. That's another hospital that we have here that we go to. We do psychiatry there. Part of psychiatry we do at Dora, acute psychiatry. When someone is acutely mentally ill, you're gonna see them mostly at Dora. Now, as they are getting to the medium-term part of their management, they are sent to Donkin. This is where we see them a little bit more stable than when they are at Dora. I mean, at Dora, and then there's Provincial. At Provincial, we do this small. They're not small. They're super specialties, you know, and subspecialties. Ophthalmology, study of the eye, ENT, ear, nose, and throat specialties. Urology, we do there as well. And then a bit of internal medicine subspecialties, neurology, cardiology. They are also at PE Provincial. Yeah.
So you 6 months from finishing, 7 months from finishing.
Yes.
What are your plans?
Is to finish. I have to finish. So after this semester, I'm gonna go into the districts, just complete it off.
So that's part of 6th year?
Yeah, that's part of 6th year.
How does it work out? What do you do in 6th year? Because now you're doing what rotation, what module are you doing?
So 6th year has got 2 modules. There's 2 big modules. Clinical specialties, whereby all the big specialties, or like, let me say, the forefront specialties are combined. Gen Surg, internal medicine, pediatrics, ONG, as well as psych.
Or it's like summing up the whole.
We go through them back to back, each for 4 weeks for the entire semester. And then in the end, you have exit exams. Exit OSCE, which is the practical part of the exam, the written multiple choice, and the long questions. All of that all at once, but then it's divided in 2 days. There are OSCE days, 2 OSCE days, and 2 written assessment days. And then after that, whether you pass or not, you go on to the next module. We call this longitudinal module. We go to the district hospitals. We learn community medicine, you know, what people at home suffer from mostly, you know, when they go to get their high blood medications, their sugar for the insulin, you know, those things. We learn that in the districts. You do that for 6 months as well. And then after that, you also have your exit assessment.
So you're going to do that next semester?
Next semester.
Which starts in July?
Yes.
Okay. And then you finish?
then we finish.
You finish.
Yeah.
Full stop, not comma.
Yes.
Now, after you finish, what do you want to do? Where do you want to go next year?
So internship is coming. Hopefully I get to end up in Pretoria.
Okay.
Yeah, I'd like to go to Pretoria for my internship. And then maybe go back home in Free State for ComServe.
Okay.
Then we see where we go from there.
So just for people who want to know, internship is 2 years in South Africa?
Yes.
Okay. And then ComServe, community service, would be 1 year?
Yes.
So you finish medical school, you do internship 2 years?
Yes.
Then it's community service?
Yes.
What do you want to do after community service?
After community service, I want to remain serving the community. You know, I want to be an immediate doctor to the people in the community.
Okay.
Either they find me in the clinic, you know, or they find me in the district hospitals. I can either do this specializing in family medicine or just being a general practitioner.
So general practitioner is someone who works in private practice?
A general practitioner, yes. That's the idea that people have.
Yes, that's what I'm trying to get
but
to.
a general practitioner is someone who has got metric and MBCHB. They are a medical officer.
Now, okay. So that's like a doctor.
Yes, that's a doctor that can be employed in any department.
So you can work anywhere, any hospital, any clinic as a medical officer.
As a medical officer. That's why you general practitioner.
So you don't have to specialize for that. You've got your qualification.
MBCHB, you post ComServe, you are a general practitioner.
And can you practice in South Africa with that?
You can practice in South Africa with that.
Anywhere, any clinic, any hospital?
Any clinic, any hospital. You just have limitations in terms of your scope.
The scope,
there are certain procedures you can do, certain things unfortunately you have to refer to more specialized people.
Yes. I've heard there's this thing of surgeons and physicians and the X-ray people. What you have to specialize to do those things?
You can work in those departments, as I said, as a medical officer, assisting in those departments.
Not as a specialist.
Not as a specialist. Now, you need to study further to specialize in these things. There's radiology. Those are the image doctors.
The X-ray people and CT scans.
Very vital specialty whereby they can see the insides of a human body just through specialized cameras
from
that
a picture,
we have. Just from a picture, and they tell a story. Very brilliant group of people. And then you have surgeons. Anything that requires a scalpel. So a scalpel is a blade that cuts through the skin. Those are the surgeons. You know, you can have general surgeons. They mostly work in the tummy, in the abdomen. You can have cardiothoracic, they work in the chest. You can have the neurosurgeons, they work in the head. Or you can have surgeons of the vessels. Vessels are these tubular structures whereby blood flows into. You can have surgeons that work with the vessels. You know,
bone surgeons.
You can have orthopedic surgeons. Those are the bone surgeons. You can have plastic surgeons. They are the surgeons who actually fix. They fix your scars. They fix your burn wounds. They fix this. They fix this. It's like aesthetics.
Okay. What about the people that bring babies into the world?
Obstetricians and gynecologists. So another group of brilliant people with a lot of change. So these are the surgeons. They are both surgeons and physicians. You know, they treat pregnant women. All the medical problems that pregnant women have, obstetricians and gynecologists, they treat this. When these women need to be cut open, you know, they become surgeons.
Cut open, these are hectic. That's a hectic word.
There's something called cesarean section. You know, obstetricians, they actually literally go into the abdomen, into the pelvis. They access the uterus and cut open the uterus. They dissect it and they take the baby out.
Hectic.
And there's much more pelvic procedures that I've witnessed.
Surgeries,
I've witnessed something called tubal ligation, whereby they literally, you see the tubes where a baby starts forming, they can cut those. They can literally cut those or tie them. We call those ligations, and a woman is sterilized. You know, when they are cut, sterilized for life. When they tie them, temporarily sterilized, we can go and reopen them when the lady, and other things, cancers of the female reproductive system, gynecology part of ONG, it does that.
So surgeons also treat cancers, and
surgeons also treat cancers. General surgeons, they will treat the cancers that are in the tummy, as I mentioned. You know, as long as it's in the tummy, it's a general surgeon. It's a cancer in there, general surgeon. It's a cancer in your chest, cardiothoracic. Cancer in the bone, orthopedics. So,
But what about the people that use the word physician?
Yes.
What's a physician?
So a physician is a doctor who don't get to cut. You know? So these are, they are very brilliant with diagnosis. They will diagnose for you, these guys.
So things like
they are good with medication. So they diagnose chronic illnesses. You know, they continue their management.
That's
your
like
diabetes, your epilepsy, your rheumatological things like arthritis, you know, lupus, you know, other things like high blood pressures, you know, TB, chronic things that people get to live with. As long as it doesn't require to be cut, doesn't require cutting, a physician takes care of it.
They treat with medication.
They treat with medication and and a lot of knowledge, reasoning.
This knowledge, did you have this knowledge before you came to med school?
No.
You learned all of these specialities, you learned
as I mentioned, the only doctor I saw was the doctor in Generations, The Legacy, Dr. Spey, and Dr. Elizabeth in Skim Sam. So
what would you say for someone who doesn't know these things, a hot piece of advice, not a head piece? What's a hard piece of advice you want to give? After you give it, I want to give the applicant score that someone should aim for. But I want you to, or maybe while you think about that, let me give the applicant score. Then I want you to think of something you want to say to someone who is in your seat in 2026, 2027, who thinks that what they've seen on Skim Sam and Generations, they want to do that. And they want to also serve the country. So I want you to think of what moved you and something you want to use to move someone else. In the meantime, I'll go through the applicant score. So an applicant with an NSC grade 12, who does NSC grade 12 mathematics, requires a minimum score of 430. So each subject that you do gets scored out of 100, and you must get a minimum of 60% in 4 main or core subjects. Those subjects are English, mathematics, life sciences, and physical sciences. So it's about a takeaway, someone sitting in your shoes 2026 and says, I want to be a doctor. What would you say to them?
In 2020, I was in the same position that you are in. You know, it didn't seem possible. I did believe that I can get into medicine because I really worked hard in matric. But the same enthusiasm that gets you through high school, that gets you through primary school, it can get you through medical school. You know, Nelson Mandela, our tata, it's a cliche, but trust me, it seems impossible just until you do it. It was a very tough journey. Year in, year out, mixed emotions, but I got through it. And I believe you can. Just pick up your your device, and apply for medical school. God knows the universe rewards hard work.
That's it from us. For more information, visit health.mandela.ac.za, and we can't wait to see you soon.